social distancing should not distance you from your money and your life as you know it. No. That's why in helping you stay safe, we want to remind you that you can actually go absolutely cashless and still run your world without stepping out of your comfort zone. Whether you need to buy data or airtime, make transfers within Ghana and across Africa, Access Bank's mobile app and star 901 hash mobile banking platforms help you to stay connected. With an easy-to-use interface, Access Bank's mobile banking options allow you to pay for your DSTV, box office or GoTV subscriptions, MTN or Vodafone postpaid bills, plus your water and electricity bills. And what's more, you can open a bank account limit. You can link it to your mobile money wallet and move your money to and from your wallet with just a touch. And guess what? If you need an emergency loan, you still don't have to visit an Access Bank branch. Just dial star 901 star 11 hash and you'll be sorted. Avoid the use of cash and run your world with Access Bank's mobile app and the star 901 hash mobile banking. Call toll free on 0800 004400 for more details. Access Bank, more than banking. Let's get talking now. Dr. Yaw Osafo, CEO, Medicus Hospital in goggles today.
Kwame, you're truly back. Wherever you went, Kwame.
Oh, Dr. Osafo,
too much.
So the standards and the shades that Kofi and Sam got for you, you've dropped them for goggles.
COVID has made nonsense of all of that. I'm going for my money. Full refund.
Guys, if you go on our live, Sam, are we live on Facebook? Hey, you remember those days, Charlie, the doctor will come into the studio with some, what's the name of the brand for? Shades, Gucci shades and one wine.
Kofi.
Hey.
When you go to the workshop, he just won't let you do for free.
You have to buy something.
Hey, Charlie. All the name of swag and all of that.
Today you're wearing goggles.
Charlie, how good do I?
Oh, I'm happy you're safe though.
Oh yeah.
Has it been over the past couple of weeks?
Difficult in the initial stages. It was always very challenging. We knew very little about the virus and how to protect ourselves.
Yeah.
Getting all this PPE properly gowned, especially when you're working.
Yeah.
When you get a suspect case, it's panic stations at that time.
Is it?
Yes, because this time around you have somebody presenting with symptoms that could be COVID.
Yeah.
It's not the same as people are coming in and saying that okay, I have an ankle pain or something. But when you get patients coming in with symptoms that meet the case definition, then initially yes, it's a bit scary. But gradually, I think we've all gotten into understand how the virus is transmitted, how to gown up properly, how to use the face mask and the goggles and so on and so forth. So I think now we've all become very comfortable. But it's still scary because the nature of our job, we can't social distance.
Yeah.
I mean, I had to do surgery this morning. How do you do surgery from a distance?
You can't do surgery from a distance.
Yes, you have to be up close and personal. So it's a bit challenging, and you always have it at the back of our mind. But it's part of our training, and you have to fall back on how well you've been trained. And
I was even going to ask that. You see how you doctors put your patient's chair by the side of your table.
I'll quit you. Don't make the mistake. so now we do social distance.
So now
when we're taking the history, that's the time that people talk anyway.
Yeah.
And that's when you get the aerosols out. So after that one, the 2 meter distance. And thankfully, at Medicus, the consulting rooms are quite spacious.
Yeah, they're quite spacious.
Yeah, so it allows us to be able to do that. So as for that one, Charlie, we're not taking
so now you realize how uncomfortable that thing was. When the doctor says come and sit here and you are sitting just in front of him, by him like that.
That's on fine, lady doctor. Probably I know you will enjoy it.
It has its perks, I know. Okay, so this week we are celebrating fathers. We want the fathers to know that we care about them.
About time, man.
You should see the smile on his face as well. Really?
Yeah. But love too is not easy. You can ask Philip.
So yes, we're talking about fathers. We're discussing fathers, and since we're doing a health as well, the health of fathers is very important. So we're doing a Father's Day special, and Dr. Yaw Osafo, you, our medical consultant, will be able to tell us what we should look out for and what men should do around this time.
Right. So thank you, and Kwame, it's good to be here again another Wednesday. You're absolutely right. Today we're celebrating fathers, and at the end of it all, I'll say hello to a few special people. Fathers in most countries and most societies across the globe continue to be breadwinners for their families, and then even for the larger society. They also continue to be, in many societies, the main conduit for instilling discipline and also instilling a culture of hard work in children, or in the upbringing of children. So they continue to play a very pivotal role. The state of a father's health can therefore have far-reaching and dire consequences for his immediate family, the extended family, and then the society as a whole. So it is very important, commemorating this particular Father's Day, I decided, why don't we talk about the common causes of ill health and even death amongst men.
The common causes of ill health and death.
And then death amongst men. Hoping that this knowledge will translate into behavior change and consequently a better life expectancy and quality of life. Because the fathers continue to play that pivotal role in the society.
Right.
So I've picked out some of the common things that I've seen over the period, and then also looking at some of the data from the departments of pathology across not just this country, but then different countries in our part of the world. Well, the first thing is what we've titled unintentional injuries and violence. Unintentional injuries and violence. Men tend to be involved in high-risk jobs compared to women over the period. So when we talk about high-risk jobs, if you take the military, for example, I mean, you have men predominantly in the fighting force. If you take the police, for example, the SWAT team, when they have to go chasing after armed robbers and so on and so forth, the high-risk jobs. Even if you look at this Galamsey menace, the pits, it's always men that go into the pits. The women are involved, but they do the other jobs. But then the high-risk ones, going into the pits collapsing. If you know anybody who's worked in a steel factory, Valco, for example, the smelters, the very hot pots where the iron or the iron is or the smelting is done. Sometimes accidents do happen. So over the period of many years, even currently, men are always involved in high-risk jobs, and with these, sometimes accidents do happen, and therefore that can lead to ill health, and sometimes that can even lead to death. So that's why you tend to have a lot more injuries and death happening in men compared to women. And road traffic accidents, when you look at them, the statistics, most drivers are men. Taxi drivers, structural drivers, bus drivers, the people who drive the tippers and then the articulated trucks and so on and so forth, they all tend to be men. When they're involved in these road traffic accidents, then of course they suffer most of the injuries. I've talked about the falls, burns, poisoning, and then also drowning. If you look at the fisher folk, we always say fisherman. We never have that expression fisherwoman, because again it's a male predominated profession or workforce. Unfortunately, two men tend to engage a lot more in violent and dangerous acts right from our teenage years. Secondary school. That's it. So women don't tend not to fight. I mean, physical fights. They fight in other ways. But hardly do you see women, going at it.
This table you are shaking.
I shouldn't shake it, Let me shake it. I won't brief for them. The men usually tend to do the fighting. When you look at the political thuggery that goes on, do you see any women in there? Landguards. So quite I have by examples. So unfortunately, a lot of violence and danger. We tend to learn to push the boundaries. A boy will climb a tree while the girl is standing there waiting for the fruit, the mango. You want to impress the young lady, so you climb the tree and then you fall down and then you break a limb and so on and so forth. So unfortunately, under the influence of alcohol and all of that, men tend to get involved in some of these things, and unfortunately may lead to serious injuries and sometimes even fatalities. So my advice is that if you work in a high-risk job as a father, then strict adherence to the safety protocols, especially for those who are in those environments that I've talked about, the factories, working in the mines and so on and so forth, then strict adherence to safety protocols. I mean, over the past few weeks, we've all heard a lot about adherence to protocols. So you do that, and then also anger management and better control of emotions. I mean, this goes for everybody, but then I think because of the testosterone, men tend to sometimes have difficulties doing that, or fathers. So that's one of the biggest categories of injuries and then death that occurs in men, unintentional injuries and then violence. The second thing I want to talk about is liver disease. If you look at the literature, it is replete with liver disease.
Okay. Before you continue,
right,
please read the first message on our WhatsApp console.
Dr. Osafo, not to bash we the beer drinkers today. Mark Cosby
Anthony sent in a message and says, please tell Dr. Yaw Osafo not to bash we the beer drinkers today. Why? With that said, please go on.
This is not fair.
This is not fair.
Okay. So this is what I have to say. But it's been like 3 months. I haven't said anything about alcohol. The moment I mention liver, then they send me this. So you, Makosi, you put something in your ear small for just 1 minute.
For just 1 minute.
1 minute.
Okay.
So I'm going to make a point about cirrhosis of the liver. This is a terminal condition. It has several causes. Commonly, alcohol abuse. I haven't said beer.
Okay. Alcohol abuse.
Alcohol abuse.
The one in sanitizer.
Like that.
Okay.
If it finds its way into your stomach, so I would mention beer. But it's usually in a green bottle. Size is about 550 mils. You have to open it with something, and then it has a head when you pour it.
You know all this.
You know. Right. So generally, alcohol abuse tends to cause men to develop cirrhosis of the liver, and liver failure is a leading cause of death amongst adult men in Ghana, and it also causes protracted ill health. There are other causes, things like hepatitis B, that also leads to liver disease and then liver failure. So my advice here is that there is no health benefit to using or abusing alcohol. I know it's a socially acceptable thing to do, but then it has considerable dangers, and then we should try and avoid it. There's HIV/AIDS, which is the next thing that I want to talk about. The virus was first announced to us in 1981, and this virus has ravaged the young adult population and grown-up men. In a lot of places now, if you look at men-women ratio, it's almost balanced now. But if you want to talk about men alone, then it's always in that top 5 entries. Sometimes, especially in our part of the world, it's acceptable for men to be a bit more adventurous when it comes to issues about sex. So men or boys tend to be a lot more adventurous and push boundaries, and may not necessarily protect themselves. So HIV/AIDS, it's a killer, and it is also a great cause of morbidity amongst men. So if you're looking at the age group between 18 and 44, it is always there. So we've got to take the right measures to make sure that we don't succumb to it. So again, the advice, very simple. We all remember the ABC. As for the A, I won't say it loud, but the B, be faithful, and then the C is condom use. So that was what they used to preach.
Yeah.
Or we still preach.
Yeah.
I mean that, to make sure that you are protected. The next item on my list is strokes.
Stroke.
Yes. So actually, there's a World Stroke Day. There's a day that's been set aside now to talk about a stroke. So, Kwame, what is a stroke? A stroke is a sudden brain injury arising from an interruption in the blood supply to the brain. So, a sudden brain injury due to an interruption in supply of blood to the brain. There are different causes, but commonly high blood pressure, hypertension. Unfortunately, I see too many men, and they're always in their 40s and their 50s, who suffer a stroke, who know they suffer from hypertension, who have been put on medicines but never take those medicines. There's a misconception out there that if you are put on antihypertensives, then it takes away your power. Not the Guinness one.
Is there a perception or it's fact?
Part fact, part perception. Part fact, because there are some of the antihypertensives, the BP medicines, that have that as part of their side effect profile.
Okay.
But when we have so many different antihypertensives that we use, so the advice is always that if we put you on a particular antihypertensive because you suffer from high blood pressure and you notice that it is taking your power away, just go back to your doctor and inform him. But I think a lot of men shy away from or feel very shy doing that. So they'd rather stay away from the medicine.
So you can actually go and then they change the medicine for you.
Absolutely. So that is a side effect. So for every drug, it has a list of side effects.
Okay.
So if you are experiencing a side effect of the drug, a known side effect of the drug, we'll either change the medicine for you, or we will give you something that will correct it whilst we still put you on that particular medication, because maybe that particular medication is good for you.
Okay.
So we will give you something that remedies that situation. But that is there so much so. I keep telling a lot of people, during the act of sex, your blood pressure can rise because your pulse is also raising. So when you climax, your blood pressure can jump by as much as 20 points. So if you already suffer high blood pressure and you're not taking your medicines, and then you get into the game, then people collapse doing their thing, and then it becomes a big issue. So sometimes in the hospital, we do see it in the emergency room. People are rushed in. Then they are very coy. Whoever brings them in is very coy about the circumstances of the collapsing.
Yeah.
And later you realize that they suffer high blood pressure. Indeed, they've been told about it. They put them on medicines. But because of that misconception they have that it will, and there's nothing to be done about it, then they stop taking the medicines altogether. So my advice is that take your BP medicines religiously if you suffer from high blood pressure, and follow all the lifestyle advice provided by your doctor, because strokes are way too common in that young adult male population. Are we able to treat it in detail one of these days and look at it inside out? Exactly. So one day we'll talk about strokes generally. Exclusively. Yeah. We'll talk about. I'll go into a lot more detail. Okay. If you have any questions you would want to ask the doctor, you can call in. Okay, 0302-216-541. 0302-216-541. Right. The other thing that's a leading cause of ill health and death in men or fathers is type 2 diabetes. So again, maybe one day we'll go into a lot more detail. We actually did talk about it. Isn't that the mellitus? Yes, the diabetes mellitus. But there's just one phase of it. There are so many different aspects. There's even diabetes in pregnant women. Okay. All right. But then this particular type, the type 2 diabetes. So diabetes is a group of disorders characterized by high blood glucose. So you just have high levels of glucose in your blood, especially after meals. And we believe this to be primarily due to the lack of a hormone we call insulin, which is produced by an organ in your body called the pancreas in your abdomen. So it has a genetic component to it. It's familiar, it runs in families. So we believe that there is a genetic component to it. You must have a certain predisposition, and then you suffer it. It has potentially many fatal complications. You know, you can lose your sight. So there's something we call diabetic retinopathy.
Okay.
So imagine you work in a certain job, you're a driver, and then you lose your sight, you lose your job. You know, you work, you know, in construction. You know, you lose your sight, you lose your job. People suffer diabetic foot ulcers, and then at a point, sometimes we have to amputate the limb, totally chop it off.
Wow. You
know, and unfortunately, we don't have the prosthetic devices at the level that we see people running with and all of that. Very, very difficult to get very effective prosthesis throughout, you know, this country. So imagine losing your limb because of diabetes. You know, it will let you lose. If you are the breadwinner, then it has a serious effect on the family.
Okay. Kofi is on the line now. Hello, Kofi.
Yes, ladies.
How are you?
Good evening.
Good evening, Kofi.
All right, Doctor is here.
Good evening.
Good evening, Kofi. How are you doing?
Fine. I want to find out when someone is taking cholesterol medicine, can that one also affect his manhood or lower it?
Okay. All right. So we don't know for the different cholesterol medications that has a side effect, their impotence. But then we also think that the high blood cholesterol in itself can be the reason why you suffer the erectile dysfunction or the impotence. So the medicines that we use in themselves, we don't know them to have that particular side effect.
Okay, Roland. Hello, Roland.
Yeah.
How are you?
Hi, Roland.
Yeah.
How are you?
I'm doing great. How are you too?
Well, thank you. Let's hear you.
Okay. He's talking about high blood pressure that can lead to stroke. And I just want to know how effective can stroke be managed, and when can it not be managed further?
All right. So as I did mention, a stroke is an interruption or comes about as due to an interruption in the blood supply. So there are different forms of stroke. Depending on the severity of the stroke, sometimes the individual just dies. They drop and then they die. If for example, the blood vessel ruptures and you have a massive bleed, such that many areas of the brain is the CPU. It controls your breathing, it controls your heartbeat, controls everything in the body. So if you rupture a blood vessel and you get a massive bleed involving vital parts of the brain, your heart may just stop beating and you may just drop dead. So the severity of the stroke greatly influences our ability to manage it. If you have a mild stroke, most people will make a full recovery. So there are different grades of stroke, and the severity will determine your recovery.
Kweku? Is Kweku on the line? I lost Kweku, right? Hello, Kweku?
Hello, Kweku speaking.
All right, Kweku, talk to me.
Kweku.
Yes, please, I want to find out something. Last week, I was having pain in the stomach. I went to the hospital. Anytime I go, they check my pressure. They say it's high. They asked me whether I'm hypertensive. I said, I don't know. I went for a scan. They said I have stones in small stone in my kidney and also my down stomach, you know.
Okay.
And they said I should drink more water to come naturally. They referred me to a specialist. I went to see the specialist, and the specialist was telling me that I'm not supposed to refer him to him because this is a smaller thing and it will go. Well, they say I have fatty kidney. What can I do?
Right. I think you would get my number at the end of the show. I think you call us and then we'll discuss it privately. It wouldn't be. We'll be breaching the ethical rules if we talk about your personal condition on air.
Okay.
So definitely get my number at the end of the show, and then we'll go into.
Let me take one more call. That's Wilson. Is Wilson off? Okay, Wilson is off. I know men have a lot of issues, and I'm really glad that you've actually, touched on the major ones. And obviously, from the feedback we're getting, people want answers to some of these things. So I think that in the next couple of weeks, you need to take them individually,
and then we'll go into it.
People are asking about blood pressure, hypertension, diabetes, and stroke. So please help us understand it a lot more, so that we can manage it and probably steer ourselves from it.
Absolutely. So we'll do this is just a bird's eye view of it. So we'll probably take it just based on the feedback that we're getting. We'll take them one by one, and then probably we'll delve into them into a lot more detail.
Okay.
Subsequently.
A lot of people are also asking for your number, so please can you help us with your phone number?
Right. So if you want to contact us, it's 0501 477 340 0501 477 340, and they can also come by Medina Firestone. That's where we are, so they can come by. It's right behind the SG bank, and then come in. This Father's Day, I think the best thing you can do for your father, if he's still alive, give him a thorough health check. Bring him in, let's check him out. There are a lot more. Prostate disease, and so on and so forth. So there's a lot more we could talk about when we talk about men's health. So bring your dad in during the course of the week, and then give him a thorough health check, so that you're not surprised by anything later in the future.
I think that's a plan. I think the best you can give your dad is a very good full medical checkup, to make sure that everything is intact and all. If there's anything going wrong, the team and medicals can help you manage it.
Absolutely.
And prolong their life.
Absolutely. The quality of life. Men have shorter life expectancies than women. Globally, because of all of these reasons.
Bro.
The beer and all of that.
The beer, they drink beer. Who said they don't drink beer? Who said women don't drink beer? Doctor, don't angry me.
Okay, I'll ask Philip later.
The
Philip, I believe
the women who drink beer, they know, they are listening right now. They are smiling. They are listening to me and they are smiling. Please, the women who drink beer, let them know I'm not lying. I beg you, because right now the whole Ghana thinks I'm lying. That no woman drinks beer.
Bubra, the big jug.
Jai,
sir.
Ladies, you confess just for today. Tell them.
Anyway, so while we all die eventually, there are things that we can do to live longer, healthier lives, and improve our life expectancies, and most importantly, the quality of life.
Okay.
So, Kwame, I want to say hello to a very, very special man, a very special father, and that's my dad,
Oh,
he's the best. He's my role model.
Happy birthday, Daddy.
God bless you. So he's special. He's really, really special, and
God bless him.
I'll see him on Sunday.
Awesome.
Father's Day.
Dr. Yaw Osafo, CEO of Medicas Hospital. Our Drive Doctor segment here on our MTN Drive Side, proudly brought to you by MTN, Access Bank, and Dole Yogurt. My father is a hero. My father is a Superman. Yeah.